Good evening. My name is Reggie Abraham, and I have the pleasure of serving as the National Campaign Coordinator for Fair Count, a 501c3 nonpartisan nonprofit that works to strengthen pathways to greater civic participation with the census, voting, and redistricting in Georgia and the nation. Welcome to tonight's event entitled Black Men Count, the Vaccine Edition. Fair Count and the Gathering Spot have come together to host this candid conversation about the COVID-19 vaccine. For our audience, if you have questions about the vaccine, please type them into the chat and we will address them towards the end of this conversation. Tonight's event will be a little bit less of a panel and much more of a conversation about the vaccine. We'll pose topic questions for discussion and have our guests weigh in. Before we begin, I'd like to introduce our special guests who've joined us tonight. The first person I'd like to be able to introduce is Mr. Ryan Wilson. He serves certainly as the CEO and co-founder of the Gathering Spot, but he also has been one of our Black Men Count co-chairs. And if I remember correctly, the Gathering Spot actually hosted us a little bit more than 2 years ago, pre-COVID, of course, for our very first Black Men Count event. So to see things continue to thrive with the Gathering Spot, with Ryan, and with Fair Count is a beautiful thing. Thank you so much, Ryan, for joining us. Would you like to say hello to the audience?
It's a pleasure to be here, Reggie. Thank you for inviting me to participate in the conversation.
Thank you, sir. I'll go next to our next guest, Dr. Vandy Gaffney. He's the medical doctor and owner of his own medical spa. Has been practicing right here in the Metro Atlanta area. But Dr. Gaffney has also done a great deal of civic engagement work, whether it's been helping people to get more information about voting or just understanding more about what it is they need to know in order to make informed decisions, particularly in the civic engagement realm. Dr. Gaffney, and one key thing, Dr. Gaffney just also happens to be from my hometown of Orangeburg, South Carolina. So it's great to be able to always work with him and to see the folks that we grow up with, us continue to work together to just better our communities and our environments together. Dr. Gaffney, would you like to say hello to everyone?
Thank you, brother. You're a brother from another mother, and thank you for the opportunity just to share, accurate information with, our other brothers and sisters that are on the call.
Thank you. Always appreciate you, man. And then our next guest is certainly absolutely no stranger to Fair Count or to Black Men Count, is Mr. Daryl Savs. He works in official capacity in government relations with Phoebe Putney Hospital down in Albany, Georgia. But again, as I said, he's been a Black Men Count member from almost the very beginning and has worked along with Fair Count on a number of different projects. Mr. Savs, thank you so much for joining us tonight. Would you like to say hello to the audience?
Hello, family. How you doing? The pleasure is absolutely mine, man. It's an honor to be with you, brothers.
Yes, sir. The honor is definitely ours as well. So if you don't mind, we're going to jump just right into the conversation.
Let's jump in there, girl.
Yes, sir. The rates of infection and death from COVID-19 have been the highest in Black communities and communities of color. Though millions of people have been vaccinated, we know there's still distrust, misinformation, and a serious lack of access to the vaccine. When you have conversations with other Black men in our communities, how much of this is being discussed, and what impact do you think this has on the number of Black men who become vaccinated? Mr. Savs, would you like to kick us off?
Yeah, and I'm gonna lead right into brother Dr. Gaffney, I'm sure. But I mean, first of all, to put it in context a little bit, as Black men, our health and wellness has never been a priority in this country's health delivery system, leading to, enormous rates of death, mortality and morbidity. I mean, we top the charts, man, when it comes to cancer and diabetes and obesity and all of those real chronic diseases. And so, the systemic racism that has been in our in that system of delivery for years, that have just denied men, but Black men in particular, from getting in. Most of these systems, they have a women's health, a children's health, but there's nothing for men particularly, because we come with a different mentality, and Doc will tell you that. A lot of times the doctors say, God, when you come, bring your wife with you. So I understand that my message is getting to you. So there's a male mentality that kind of blocks it out. But overarching that is the racism and the denial, brother. And it's so hard. I'm going to try to stay in this lane of health, man. But what's going on in the country right now with Black men being looked at as a lethal weapon and not as a human being is just so, it's so hurting to all of us. So also, given that background, when COVID hit us, brother, we were almost the epicenter. We got hit first. We didn't know what was going on. We didn't know how to mitigate, Doc, what was coming through the door, and decisions was being made, and there were no guidelines being offered. People were dying, and death was just all over the place. And so, trying to mitigate and get in the middle of those mixed messages and the lies and the politics, and it just left a lot of people dormant, even though we were scared to death. Man, I was almost peeping out the window thinking it was a monster coming, talking about COVID coming in, but people were just fearful. And since that, of course, we saw what it did to underlying conditions, which were so present in our communities. And so when you add all of that together, it just, I was glad to see the vaccine. Many people were happy to see a vaccine. And I'm sure that Dr. Gaffney will talk about the efficacy of the vaccines that we had. But in my community, it wasn't a very hard decision for men and women, particularly Black men also, because they were dying more often and sooner in our community. But it wasn't hard to convince people that, man, you got to do something. Something's got to happen. You're dying. Nothing was, no science had been developed yet. But as soon as we saw there was some hesitancy historically, and there was some hesitancy just around the fact that they didn't trust the biology, doc. But what I saw was the more access, the less hesitancy. So I'll stop right there.
Gotcha. Wanted to kick it over to Vandy, Dr. Gaffney.
Sure, absolutely. I mean, Mr. Sabbs hit it on the head. Access and information is paramount, right? And so let's back up to kind of, almost March, April last year. We heard, stay indoors, social distance, when, you had to be out, wear a mask, because we wanted to flatten the curve. Flatten the curve was trending. Everybody was posting about it on social media. And then one thing happened. We started to get the research back of who was being adversely and disproportionately affected by the COVID-19 virus and those that, carried severe symptoms. And what we found out is that it was Black and brown people, particularly black and brown, older people and older men. And then what happened? You start flattening the curve, just magically disappeared, right? It was reopen the economy. We got to open. What about jobs? What about our money? And that's because the powers that be realized the ones that were affected the most, which is always happening in this country, are people that look like us, the people that are on this call, those who are always in, the brunt of the plight of America. There's a saying, when America gets a cold, Black folks get the flu, get pneumonia. And so we have to be very vigilant of where we get our information, who we get it from, and then fight for our access. And as Mr. Sabbs said, at the beginning, there was some hesitancy, but I also want to pat us Black folks on the back. When it comes to vaccination rates amongst Americans in this country, Black women and Black men actually outrank white men in America. First time that's ever happened, right? Because you have a lot of misinformation on their side. And what you've seen since the beginning of the holiday season and now into the spring is that the deaths of white Americans has quadrupled. The death of Black Americans has actually gone down. And that's because we got the information from trusted sources like the people on this call. We started talking to, our Black doctors, our Black scientists, our Black leaders, professionals. We started doing things that were intentional and strategic, like this call. And so we still have a long way to go. And when it comes to the mistrust, I mean, it's absolutely warranted. I mean, just looking at how the years and decades and even centuries of racism of the American health delivery system has disproportionately just shut Black folks out. But it's also incumbent upon us to get the information because we're the ones dying from it. When we are hungry, we find food. If we want to seek information, we have to go to those trusted sources and individuals and get those resources to better our own community.
Definitely. Thank you. And Ryan, wanted you to hop in as well.
No, I've talked to a lot of folks, and it's been concerning, especially early when the vaccine was announced, how many folks just did not want to participate at all. And look, I think it's important when we hear that to meet folks where they are to a certain extent and meet them in a conversation that's rooted in love. As frustrating as it was for me to have these sometimes what felt like extremely long conversations with folks trying to get them to take their own healthcare seriously, I do realize, and I think it's important for us collectively to realize that, look, there is a history here that is that's relevant. One thing that I've been saying though to folks that are hesitant to take a vaccine is this. Look, racism, particularly as someone that is Black in America, is something that you always have to be mindful of. But the vehicle, the way that this form of racism is hitting our community is in lack of access to vaccines, rather than there being something ineffective. And my ministry is not medicine. I'll let Dr. Gaffney talk to us about the efficacy of the vaccine. But from what I understand, it's our access to the product and not the product itself, which is what we need to be more vigilant about at this time. So I've been trying to keep that at the forefront of conversations. Again, rooting the conversation in love and understanding, but ultimately trying to push folks to get across the finish line and to protect themselves.
Gotcha. That sounds great. Thank you, gentlemen, so much on that one. The definitely great information there to be able to know and be able to hear. The next topic that I wanted to be able to talk about was wanted to talk about a little bit more about the vaccine itself. There, to all of you all's point, insofar as like the access part, which we'll talk about a little bit later, but there's still questions that have been posed as early as this morning about the vaccine itself, where I'm sure all of us and a number of people watching saw the announcement that the FDA and the CDC was going to pause the Johnson & Johnson vaccine at federal sites after 6 cases of a rare disorder involving blood clots were reported. I wanted to pose this question first to you, Vandy, but also wanted to make sure everyone had a chance to weigh in. Through either your professional and or personal experience with the vaccine, what is it you would like Black men to know about the vaccine's safety, its effectiveness, and or its side effects?
Yeah, I got the messages like everybody else this morning, and I knew it was a topic that we're going to discuss. So first and foremost, the vaccines that are mRNA vaccines, and we'll talk about that information in a minute, as well as this Johnson & Johnson DNA vaccine have been thoroughly tested. So one point I want to make is this is the world's biggest science project. We were all in school. We had to do science projects with groups of people. Not since the Manhattan Project, trying to get a nuclear bomb, has the world been working on one particular project at the same time. And so multiple scientists from across the world have been looking at and figuring out how to come up with something safe. Secondly, I tell people, trust greed. Pfizer and Moderna are making does not work. They're going to hook to lose everything they've come up with in terms of research and development, as well as potential litigation, even though there were some laws passed about that. So they want to make money. And so they want to make money, and they can't make money if people are sick from their product. But just in the the process itself, Pfizer and Moderna are mRNA vaccines, meaning Basically, those vaccines have no virus in them. What they have is a photocopy of a spike protein, or basically identifier, so that when your body gets introduced with the vaccine, it has already seen this photocopy messenger. So when the actual virus does make its way into, your body's already produced enough antibodies that you will not have any symptoms, or your likelihood of severe symptoms is greatly reduced. So that's much different than the typical, pertussis, flu vaccines that use either deactivated DNA or parts of the actual virus. So that's why it's a little safer, one. Two, at the beginning of these trials, March and April of last year, Pfizer had around about 40,000 and Moderna around 30,000 people that went through the whole CDC process within the United States. 99 sites for Moderna, I think 112 or 15 for Pfizer. All across the country, people went through stage one, which is, a couple hundred people looking at it. Is this safe? Stage two, is this safe and can it be effective? And that's the key. Can it be effective? And stage three, where thousands of people have it, is this safe and very effective, at reducing symptoms? And so you have to go through this process. And that's when we decided, well, the CDC and the FDA decided this was safe to roll out. And because of the science happening across the world at the same time, we can, look at data from Argentina, Australia, Amsterdam, and Atlanta all at the same time and say, look, we did it this way. When we did it this way, we got this effect. When you did it this way, you got this. If we all tried it the same way, do we all get the same, results? And so that's why this was a lot faster. On top of that, the governments, typically when a vaccine is rolled out, you don't have that much government support. Governments around the world gave these researchers the resources to try to get this done quickly. And in order to make sure we had enough vaccines to roll out quickly, at the same time where they were researching these, the vaccines for their safety and their efficacy, meaning do they work well, they were also producing a stockpile. So when we figured out, all right, this is safe, this works for people, now we can roll out in a significant amount of numbers to get it to the population to actually take effect as quickly as possible. So those things all kind of lined up to get us to where we are. In reference to Johnson & Johnson, it's good that we have an administration, a CDC now, that can actually say, okay, let's make informed decisions. So when those 6 ladies, unfortunately got those blood clots from Johnson & Johnson, we were able to pause and say, okay, look back at the data. If it's between 6 to 13 days, if, the ladies' age range was from 18 to 48, let's stop and figure out what's going on with that particular subset of patient population. But for everybody else who's had this, over a month or what have you, because Johnson & Johnson has been rolled out for about 6 weeks now, they are not at risk, or they think the risk is low that they'll even have something because they're past that 14-day window. And then lastly, this is 6 cases, and unfortunately 1 mortality out of over 7 million vaccines distributed by Johnson & Johnson. So you're talking about 0.00008%. And so that's important to take that in mind. No life lost is, unimportant at all. And we want to make sure that people understand that. But when it comes to Pfizer, Pfizer and Moderna, you're talking about 95% efficacy. Adverse effects, the most common one is injection site pain. So that's, right at, where you receive the vaccine. And, Johnson & Johnson was above 90%. And so it's good that we're stopping to figure out what's going on. But this is extremely safe. I got vaccinated in December. It's April. I'm fine. I haven't grown a 6th finger. I don't have an eye popping out outside of my head. People, in the conspiracy theories, but you have to get the information from those who are going to really tell you, who've already experienced what you're interested in knowing about, and getting the information that is, accurate, up to date, and it's going to put you in the best place to be safe, you and your family to be safe.
Definitely. Ryan, did you want to jump in? Want to weigh in?
No, I thank you. I mean, I think that this is the sort of information that we need to make us feel more comfortable. I mean, I don't have anything to add except for, I mean, genuine gratitude to know that, I mean, we have medical professionals, and I think it's important to underscore just even what that experience is, right? I mean, this isn't a casual thing to be able to put MD behind your name and to speak to, what we need to know medically. And so, thank you for breaking it down for us, but also doing it in a way that, again, I think a lot of the conversations that we're having around the vaccine, we just got to turn the temperature down inside of the community and have real facts based discussion, which is I learned a lot. I'm vaccinated too, and no six fingers for me either. It's been I had I had a couple of symptoms after my second shot, like a lot of folks do. I woke up the next morning and got to it. All right, and I think that we've got to tell people our experiences and not hide anything from it, but knowing that like the steps that we're taking are putting us on a much better trajectory than where we were a couple of months ago with no vaccine and disproportionately being killed by this virus. So.
Gotcha. Thank you. And Mr. Savs, anything you want to add?
Yeah, Russ. So, and Doc, thank you so much for the science, because I think if we have never appreciated science before, we now know the role that science critically plays in our lives, and the facts and the truth and the knowledge is something that before we never depended on it the way that we are. And I think it's a new introduction to some of us to realize that we all are citizen scientists, and that's something that we need to understand, to know. Now, I've had both of my shots, and I'm not lighted up like I'm not in a big ray as I walk around. Some people say it's going to light you up if you get the shot, but no, I've had both. And the other interesting experience of mine, brothers, is I have a funeral home business, right? Now, I got a 115-year-old funeral business that I saw, swell in numbers, instantly in an amazing way. I mean, the deaths that began to roll in. I mean, I saw the occupancy at the hospitals, right? And I saw the death rate, and I saw the rate of COVID in the hospital. And now I see the rate lessening. Okay, I see in one of my hospitals no COVID patients at all. In my main hospital, the number is so lower. The death rate and the hospitalizations are so lower, and I can only point to the vaccine and the fact that in this small rural community, and particularly as we went through the age groups, the majority of people have been screened. And so I'm seeing the effect of it, and listening to the science and knowing the facts and seeing the evidence on the ground is very special to me, to know that science can produce so rapidly the way that it did. As my brother said, man, there are 300 million people in this country. The supply chain to get vaccines to three. I don't know if we've ever, Brother Ryan, you do the gathering spot. You know what it is to host 400 or 500 people, or try to give direction to a group of people to go all in the same direction, right? Man, 300 million people in the supply chain, and how you dropped it and where you dropped it, and then given the politics, it was a massive, and it still is a massive job to touch the lives of all of these people with such a big project. And so when you look at the scope of it, if you got a few people, real low percentage, you're going to have some error. You're just going to have some error. But we live in a world of media saturation and social media saturation, again, that sometimes these news stories can get so super heightened until it can almost take the place and be so loud of the good things that's going on, and it can be so confusing. And I think in this case, there would be a margin of error given the vast scope of engagement with this particular product, so I'm pleased, I'm happy, and I think we're doing it the right way, but we just got to stay on our toes.
I think that the way, if you look at disinformation, I think that that's the vehicle that racism is riding on into this conversation, right? Where because there is an understood history of the way that Black folks in medicine have unfortunately interacted over our history in this country. I think that it's known, right, that by talking about risk, it's been fascinating to me to watch for when there has been an overemphasis on getting supply to our communities, how if you actually go to the lines in those communities, you have folks from way outside the community that are making their way to get that resource. And it's something we got to talk about, right? Because by sending us disinformation, and then again, understanding all the stats about how we're dying and how healthcare challenges exist inside of our community in a different way, there are other folks from a lot of times the northern side of town that are making their way south for the first time probably ever to take advantage of access to a resource that has been allocated for folks in our community. Sure, everyone needs to get vaccinated. Don't hear me, and I'm not saying that. I'm saying though that like where there's been specific efforts, there have also been even more specific efforts to make sure that we don't feel comfortable taking the vaccine, even though it's being supplied to our community.
You're right.
My brother said the most hesitant community of folk demographic are white Republican men.
Mm-hmm. But to that point, Ryan, I mean, you got like Governor DeSantis out in Florida being investigated for selling the vaccine to wealthy, donors of his, and taking it and putting it in rural areas where, it shouldn't have been rolled out compared to population centers like Tallahassee and, in Dade County. It's fascinating, but it's also disheartening. And for any skeptics out there, even though let's say, the deaths from COVID are, well over almost 600,000 people have died in this country alone. I mean, just think about that. I mean, you're talking about the Georgia Dome or now Mercedes-Benz Stadium 6 times over. Talking about families that have lost matriarchs and patriarchs. Family history is gone. And you feel like, okay, if I contract the virus because I'm young, I'm relatively healthy, it's not going to affect me. You don't know who you're passing it to. You don't know the person you're passing it to, whether they've been vaccinated or not. You don't know their underlying history. You don't know. I mean, and also, if you look at the research, the mortality, the death of young people has gone up since we started to open back up. And even we live in Atlanta, Atlanta pretty much never closed. Miami's wide open. Houston open. And so you're going out having a good time, but you go and see your family members during Easter and Christmas. You don't know what you passed along to them. You mentioned you had a funeral home, Mr. Sabbs. I had a cousin in New York City whose father died because he had a funeral home, had patients who, died from COVID in December. We're talking March when we did a national, stop, but this was December, and got sick in January and died. And so, we can all remember or know somebody who was personally affected, died, who had severe symptoms. But we also don't know what COVID looks like 10, 15, 20 years from now.
Yes.
Nobody thought, asbestos when we were putting them in our roofs and our walls was going to cause mesothelioma. Nobody knew lead paint was going to, cause brain injury. Nobody knew, nobody knew these things. Walking in a coal mine in Kentucky was going to give all those people black lung, So you want to be protective as much as possible. And so we all want to be blessed to be, Mr. Sabbs' age and older, be able to see our families grow and be active and have a good quality of life. And so when it comes to the risk of dying from the virus itself versus the effects of the vaccine. I mean, the virus it's far and away much more contagious and much more deadly than any vaccine we've seen that has been rolled out here in the United States.
So you're saying no matter what the hiccups, the efficacy is strong in all of the vaccines. Is that what you're saying, Doc?
Absolutely. It's far and away safer. I mean, I'll put my medical degree, all my years of reading books while y'all out here turning up in these streets. I was with y'all sometimes, but
a few times.
It's
Here we go. Let's go.
Exactly. And don't get me wrong, we all want to get back to those times. We want to get back to going to Ryan's spot at the gathering spot and catching up with old friends. I mean, that's why those safe havens like the gathering spot are so important. It gives us a reprieve from the ills of the world that we can get amongst our people and have conversations like this. And so it's far and away safer, folks. We're not on here to tell you anything that's going to hurt you. Like I said, like Reggie's my brother from another mother, Mr. Sabbs, and we actually go way back. His son took great care of me in college. I've, patronized and visited Ryan's spot a bunch of times. I mean, our Black folks, we're interconnected everywhere. No matter where you're from, we have a shared experience in this country. And so, and even as a patient, last thing I say, so I got sick in June. I thought I had COVID. I got tested 5 times in 2 weeks. Like I didn't have COVID. But I started to lean on even the more experienced people like Dr. James Hildreth, world-renowned researcher on virus immunology, president of Meharry Medical College. Who better to listen to than the president of Meharry?
Right.
Dr. Kismika Corbett, Kissy Corbett, Black PhD scientist, virologist for the Institutes of Health, was a part of the vaccine composition team. So you got your people doing this, and we're doing it the right way to make sure our communities are the ones that are going to benefit. And like Ryan said, they'll come from Buckhead, Alpharetta, Sandy Springs, Dunwoody, go over here off of Swats, MLK, and in Adamsville to get this vaccine, hop back in the car and jump on 285 and go home. We got to we got to use the resources that are, allocated for us.
And
hey, Ben, let me hop in real quick. Hey, can I hop in real quick? Because I want to make, y'all starting to get warmed up. We're doing a great conversation there, but I want to make sure we continue to kind of move forward, because some of what you're saying is in some of these other questions. I want to kind of jump to the next one. And we were literally going to that point. And Ryan, I'd love it if you could lead us off with this next topic. As we all know, Black men are entrepreneurs. To your point, Vandy, whether it's a club, a restaurant, a barbershop, a lawn care service, we turn ideas into businesses. But when the pandemic first hit and businesses suffered or closed, exactly to your point, Vandy, we lost a lot, but we lost more than just income. We lost meeting at that restaurant to watch the game together, or talking trash at the barbershop, like how we just take for granted that we've always been able to do. Even along with that, we lost date nights with our partners. So essentially, part of what we also lost was community with each other. The question I have for you all tonight is, what are some of the adjustments Black men have had to make with our businesses during the pandemic, and what effect do you see the vaccine having on both our return to our businesses and our return to our community going forward? And Ryan, I'd love it if you can kick it off for us.
Yeah, I mean, to talk about the vaccine, I mean, you have to really talk about the virus. And so what did the virus do to Black-owned businesses? A lot, right? I mean, depending on when you were looking at the stats, and it's still scheduled that 60% of Black-owned businesses were not going to make it to the end of 2020. That stat has been projected out to continue on through 2021. So the economic hardship that Black folks were facing was severe, and a lot of that was tied to access to capital and to liquidity going into to this unfortunate economic event. As we've already said, when America gets whatever it gets, we get that virus a couple times worse, and that's what we saw from a small business perspective. At the same time, I'm an optimist at the end of the day. The thing that I'm encouraged about coming out of this season is that Black folks in particular, right? We know something about crisis, and Black entrepreneurs especially understand how to do more with less. That is how the vast majority of our businesses, for other reasons, unfortunately, have to get started. And so, what we're seeing now that I'm excited about is the creativity and the ingenuity and the hustle that exists inside of our community that's going to position us coming out of this to go on and be able to thrive, learning lessons along the way that, I'm glad that we've been able to have important conversations about. Things like having a good banking relationship. If you weren't banked well going into COVID, it wasn't a good time to call a banker for the first time when PPP came out. And so we now get to take, again, the thing that we know well, our hustle and creativity, and apply some new skills. So I'm at the end of the day, optimistic. We still have to take care of one another, though. And that's the last thing I'll say. I mean, the stat that has haunted me is that this goes back pre-COVID, that Black folks spend 97% of their income outside of the community. And so if we don't change that, the businesses that we have already lost and those that may not even get started, we won't see the sort of business activity that we need if we don't get active about supporting one another. And that's not anybody else. That's that 1.3 or 1.4 trillion that you see reported a lot. That's money that's already in our community that, again, 97% of it is spent outside. So I hope I answered your question, but we'll be okay. We've always figured out how to be okay. So we will get through this storm like we've gotten through other ones.
Definitely. Gentlemen, I want to see for both Vandy and Mr. Savs, I'm going to try to see, I don't want to cut you brothers off, but try to see if we could, I'd like for you all to weigh in, but if we can do it about around the 2-minute mark, because we want to kind of get one or two other questions in before we have to kind of wrap up. This is an incredible conversation. I really don't want to wreck the flow at all, but just want to let y'all know there's one or two other questions we want to get to. So if you all could please weigh in about around 2 minutes, we'd greatly appreciate it.
Yeah, absolutely, Reggie. This is my life. I started my small business, my med spa, in the third quarter of 19. So COVID almost killed me twice. And as Ryan said, relationship with bankers, having the forethought, trying to be resilient is why we're still standing. Black folks have always had to do that in America. And unfortunately, many brothers and sisters lost their business. But, the song lyric, trying to make $1 out of 15 cents is real. And we have learned now, as Ryan said, to better our relationships, to foster partnerships, to leverage, our talent and our resources in a better way. And so I think that's what we're going to see across the board for Black businesses and for those that are interested in starting business.
And for me, our resilience is the word. I heard Ryan say and Doc say it too. I think it's a point of resilience because we're used to coping. We're used to sacrifice. We're used to isolation. We're used to all of the conditions that it threw us into. Although it was, a hell of a crisis for all of us. Our demeanor and our culture and our history prepares us, man. And so I saw resilience. In my business, we just pivoted. Of course, it was a business needed at the time, but a lot of businesses pivoted and did other things. Their resilience allowed them to share with their communities and to meet them where they were in many creative ways. But I think the resilience that is just innate within our spirit and our soul as a people is really what carries us through.
Yes, sir. Definitely agree. And thank you all for those answers to that. The next question is pretty much like a two-part question, and want to be able to hear from all of you all once again. Want to know two essential things. Number one, we've kind of identified a little bit more about like misinformation, about like our resilience and just the vaccine itself. But insofar as like what we can do and what steps we can take to be able to share amongst ourselves, but with our audience as well. The two-part question is, can you name for me what you feel as though are some of the things that Black men can be doing to assist in COVID-19 recovery efforts and in getting accurate information out? That's the first one. And then number two, as Black men are making the decision on whether or not to take the vaccine, could you please tell me what you all feel is the information that we need to have? We can start it or kick it over to start off with you, Mr. Sabbs, if you like.
Take the
again,
vaccine.
Those questions are.
Take the vaccine.
Gotcha.
Get the vaccine. Go get your vaccine. Get vaccinated. I mean, that's the major point here, I believe. And that's my point. Go ahead. You go ahead.
No, go ahead. Please continue.
Huh? No, go ahead, brother.
No,
go ahead,
please.
brother Doc. Go ahead. I'm gonna rest it. Right. Go ahead.
Doctor. I mean, Mr. Sabb said it right. I mean, the vaccine is safe, folks. I can't say that as much, as it needs to be. It's safe. I'm going on almost 5 months. Ryan, Mr. Sabbs, we've been vaccinated. Your family, your friends, your doctors, the people you trust. Like, who do you trust? Who in your family you trust? Who's always giving you accurate information? Who's always been the person you lean on in your time of need? Go talk to them. Get their information. Because usually those people are going to be someone who's gotten their information from somebody they trust. And that's why we talked about that connectivity. We can all talk about find a family member or a friend. I've had multiple college classmates hit me up and say, man, what's your thoughts on this? Bro, I'll tell you exactly how I feel. Go get the vaccine, because you can keep yourself, your family, your significant other, your kids safe. I mean, when we talk about why people are coming into our neighborhoods to get a vaccine that would never ever come to your neighborhoods, you best believe they don't know anything that we don't know. They just know, all right, I'm gonna get this done because it's supposed to be done, and it's how I'm going to protect myself and my family. I mean, it's just get the vaccine. It's simple, man. 2 times, you're talking about a few minutes, depending on where you are. And even if it's 2-3 hours, man, we wait in line for any and everything else, to get to a movie, to buy some shoes. When we want information and we have something we want to get, we'll find out where them Jordans are dropping and be there all day. But now when it comes to our health, now we talking slow. We want to pull up a little slower, go get the vaccine, take care of yourself. And then after you get this vaccine, now you can go turn up in Miami or, wherever, and have the peace of mind that you're not hurting yourself or others. So, go get the shots.
There's if I can say that, there's a space of leadership that is begging for Black men to step in. There's such a need to guide our communities and our families that Black men traditionally play a very key role in. And I'm seeing men, be called toward that mission. And it's in all of our endeavors, in the social, political, and economic endeavors. There's a space for Black men to get involved and provide some leadership. I mean, I love our sisters and what all of our sisters are doing all over the country and all over the state. But even the Abrams family saw it was very important for us to specifically focus in on our brothers, on our men, in the role that we play in our communities. As much as we try to get defamed and disrespected, we know inside of us the real fear is what's in us and who's in us, and our ability to be strong leaders in our community. We are that mighty giant in our families and our communities that other system or white racism really fears. So when we as Black men are united, we can conquer the vaccine, the politics, and everything else ahead of us. So I encourage Black men to get involved, to be participants and not spectators. Number one, get that daggone vaccine.
Gotcha. Thank you. And thank you all for these answers to these questions.
But Ryan got a little something over there too now. I see Ryan, he's
Oh, I'm sorry, Ryan. My bad.
chopping at the bit. Come on, Ryan, get some of
Come
this.
on.
Yeah, they've said what needs to be said. Take the vaccine, y'all. I mean, I will lay out an economic justification. I can't do a medical one, right? But if you look not only are we disproportionately dying, we disproportionately are in roles where we're on the front lines of potentially being exposed to the virus, right? For that reason, right, for our own personal safety, we need to get vaccinated. But then you have to start to ask yourself, if there's a conspiracy to do anything, right? There'd be a conspiracy to make sure that the population that is disproportionately in roles that are essential, that have been deemed essential for this entire time we've been on lockdown, right? That those folks are able to get back to doing their work. And that's a whole nother box that we need to open and unpack at a later date, right? But if there's a conspiracy to do anything, it's to make sure that every American, but certainly Black folks, have the ability to safely be back at our post, right? And we have to talk about it like that, because again, if we talk about it any other way, we lead ourselves. Everyone eventually is going to have to get vaccinated. What's happening right now is just about when. It's a timing issue more than anything else. And so, at least that's my belief. I think that we're going to trend in the direction where it's going to be mandatory. I'll be curious to see what Dr. Gaffney has to say, but I can't imagine a world where this is not going to be, but basically mandatory.
Yeah, I'm gonna come short of mandatory because there comes legal and kind of issues there. But Ryan's right in terms of why you need to get vaccinated and how we're trending in the right direction. 90, I just looked just now in the CDC stats, and 192 million vaccines have been administered in this country. You're not anybody's, lab rat or guinea pig right now. Okay. Those folks who's, valiantly signed up for those actual studies almost a year ago. We're talking about April, March, May was enrollment last year for all these studies to prove that this was safe. So we almost got 12 months of data of how people, and these people that you knew, who enrolled in these studies. So you're not anybody's guinea pig. You're not the first, second, third. You're not the 100th person to get 100th millionth person to get a vaccine in this country. Excuse me, not in person, but an actual administration. And so it's safe. People, there can't be a conspiracy this big being held under wraps with the entire world.
Yes.
No, it ain't 5G. We know that. It's just not, something in the cards where it's, they're not injecting any tracker in you. You pay $1,000 to carry the tracker willingly. It's called your cell phone. Yeah. This is safe science to get us back to a point where we can interact and be with our loved ones, where we can make money and keep the world turning as it is. And so, do your part to protect yourself and others.
One stat we have not seen, brother, but you correct me, Dr. Gaffney, if not, I haven't seen somebody who's taken the vaccine and died.
Nothing that I'm aware of when it comes to.
You don't die. If you take the vaccine and you get COVID, you will not die. You may get a little sick, but you won't get deathly ill. So it's your choice. Sure. If you get it, you're not going to die from the COVID if you get that vaccine in you. I haven't seen any cases of, we've seen some, blood clots maybe in some cases, but nobody who's gotten the vaccine has died.
So they updated and I want to give people accurate information. They updated that actually one person from Johnson & Johnson died. One of those ladies did die, which is, I think, which was the tipping point as to why they did the stoppage of the actual administration for Johnson & Johnson. They were like, okay. And I think that's important. I think that's important to figure out why this happened. Was there something specific for these individuals?
One person out of how many, bro?
We're talking about well over 40 million people in this country.
Okay.
So you're right. We're talking about, I think we're right around about 14 to 15% of our country has been inoculated with both injections.
That's amazing. Yeah. All right.
Herd immunity with the population.
Herd immunity, huh?
Herd immunity. So that's 70%. That means when we get to that 70%, so, quick math, you're talking around 210, 215 million people are vaccinated. Right. The likelihood of all of us getting introduced to the virus and that virus causing severe symptoms goes down exponentially. So when you're talking about getting vaccinated or not getting vaccinated, you're prolonging us getting back to a new normalcy, getting back to a new,
Yeah, I'm trying to go to Turks and Caicos, man. Why don't y'all come on get these shots?
And the Maldives got my name on it, bro. I'm trying to get there. Hey, come on, help me.
And I need to hang out with Ryan. Come on, y'all. Let's do something.
Right.
The side chicks and crud. We getting ready to go down.
Everybody wants
some trouble.
Exactly. We all want to go to homecoming. Everybody wants to go to these HBCU classics. We missed it.
You better get it, Reggie. It's about to turn.
And so, get your vaccine. It's safe.
Yes,
talk to your medical professionals, the people you trust with your health and your well-being. And also misinformation. When somebody introduces it to you and it sounds crazy, say something. It's like, nah, bro, that don't sound right. Go get you some accurate information. Go to, Johns Hopkins has a very good website with actual good information. A lot of it is done, particularly there's a segment for minorities and the COVID-19 vaccine.
Okay, that's what I was going to ask you, some references that we could go. I know Georgia Healthcare Georgia Foundation has done some stuff, but there's a lot of information out there, brother. Isn't that right?
Absolutely. And so, like I mentioned, Meharry Medical College, their president, part of the original Operation Warp Speed. Black Doctors, the National Medical Association, which is the oldest society in the country for Black doctors, kind of complained to the administration, the previous administration, like, yo, you need to include some Black people and some Black research. So they went to Dr. Hildreth at Meharry. They went to Howard and got, researchers and Black folks involved, because we need information to know this is safe specifically for me, for Black folks, for us. Right. And so you have these prominent individuals who've run these tests, who have said this is safe, and it's safe specifically for us Black folks, simply for us Black men, Black women. And, when we're the ones who are dying at almost 3 times the clip that everybody else is, and when the virus is introduced, and also disproportionately affected economically when it comes to job loss, unemployment, the inability to start businesses, this is a no-brainer. This is how we get, increase our footing and get back to solid ground here, folks.
Hey, on that one, if y'all don't mind, I know we're getting towards the end of everything. This has been absolutely amazing. Thank all of y'all so much for your input and everything. Wanted to be able to get to a point where we were beginning to wrap up, but we had 1 or 2 questions. To be honest with you, you all have answered 1 or 2 of the ones that we had, but there was one that just wanted to pose, and I'll kick this over to you, Dr. Gaffney. I believe we did not didn't have a chance to answer, which is, we had a question of, do I need to get the vaccine if I've already had COVID? And want to kick that to you.
That's a good point. So the best way to find out is you need to get tested about whether or not you still have antibodies. So let's talk about testing for a minute. The rapid antigen, basically saying I have the virus on the surface in my cells, mostly the nose, is a very quick test. You can get that back in 15 minutes. The PCR, polymerase chain reaction, is a definitive test. It says tells me yes or no definitively where you have COVID. It looks at your cells and actually tells you whether or not your body is actually fighting the virus. And then you have antibodies, and antibodies are the way the body fights viruses and bacteria. If you have antibodies to the virus, then you have at one point been, not inoculated, but it had been introduced to the virus, is introduced to your system. What we're finding out now is that even if you had the virus at some point, having antibodies or your level of effective antibodies goes down over time. So you may need the vaccine if you've gotten COVID, X amount of months ago, and now are not showing the immunity, and the immunity is the antibodies to fight the virus if you were reintroduced. And there are reports of people who are getting COVID a second and even some rare 3rd times. And so that is why it's important. Even if you got the virus, you can't sit back, I'm good. I got the virus. I got antibodies, I'm Gucci. No, you have to find out whether or not those antibodies are still effective. If they have a high enough quantity, meaning actual number, and quality, meaning effectiveness. And so you did get an antibody test, which is a very quick $10, $20, some places free blood test to figure out, okay, this is still in my system. That will then tell you whether or not you need the vaccine. But the best thing to do is talk to your medical professional about this, and you can do that on an individual basis and figure out what's the best plan and action for you.
Gotcha. Thank you so much for answering that. And again, you are really in your answers, your thorough answers. You've answered like a few of the other questions that we had. So we'd like to go ahead and wrap it up. I know we're getting close to about the hour mark, but this conversation has been so great. Thank all of you all so very much. On our wrap up part of this, just real simple, quick question, and we'd love for you all to take maybe like a minute or maybe like a minute and a half, just to let us know, insofar as us wrapping up, we'd like to hear from each one of you all. What is it that you'd like to be able to leave with folks today as we wrap up right now? What message, what information, like what is it that you'd like to be able to leave with us? And if you don't mind, I'd like to be able to start with Mr. Sabbs. We can go over to Andy and then end with Ryan.
I think for me, it's understanding as Black men the power that we have, and our mission as men in our families and in our communities, and how much our communities really do need us, how much our families really need us to be the leaders in our families, and oftentimes, when men stand up, little boys sit down. Our community need the strength and the wisdom that our men will provide for us. And so my takeaway is to always remind men that of the bright spot in terms of the role and the leadership that we play in our communities, and how our families depend on us so much, and our communities depend on us so much to give that leadership. And we can't do it if you're not healthy. I mean, we're dying sooner than any other demographic of people, and we're leaving, families, wives widowed, and families without daddies. And so we do have a responsibility. There's healthcare, but then there's self-care. There's some things that we got to do for ourselves, brothers, and there's enough knowledge. Our bodies don't come with instructions, but yet there are brothers out there like Dr. Gaffney who can help us understand these bodies and how they work, and what we need to do to stay healthy. So, seek out the information, but know within you, man, you are a king, and you have powers to be able to do and to change. We got the census is going to call for us to have reapportionment probably later in the year. These districts are going to be split up. Hopefully, we'll take them to court, and all of that, it gets slowed down. But you know that this midterm is going to be crazy. We need to be registering the vote. I know I'm getting off of health a little bit, but it's all interconnected. So be diligent and stay woke and take your rightful place.
Absolutely. Health is wealth, brothers. Health is wealth, brothers and sisters. I mean, you can't do anything if you yourself are not healthy. You can't, as I said, be the breadwinner and provider of your family, for your business, for your community, if you are not in the best health mentally, physically, and spiritually. And when we've talked about more so today, your physical health, but it's a peace of mind knowing that I can go out in the world and be safe by having this vaccine. It's a peace of mind knowing that I'm not going to get my mother and my father, grandmother and father sick, and they could potentially die because I got vaccinated. It's a peace of mind that I can go out into this world, stake my claim as a Black man in America, which comes with all kinds of stress, as we know. And I don't have to now have, that as a problem. We got 99 problems, don't let COVID be another. Get the vaccine and, strike that off your list and keep chugging, keep doing what, the best thing you do for your family. And, just like you said, stay woke, stay connected, and stay in love.
Yeah, we can't be the last folks to get this resource. So let's make sure that we do all of what they just said. Take care of ourselves, take care of our families and our communities by making sure that we are getting access to resource that ultimately will help make us safer and will get us back to doing the things professionally and socially that we love to do. So as was just said, we do have 99 problems, and I don't think that the vaccine should be added to that list. It's been proven safe. Folks inside our community are saying so as well, and time for us to listen to them and get back to it.
Gotcha. Well, once again, on behalf of Fair Count, I definitely want to thank Ryan Wilson and the Gathering Spot for hosting this with us and participating in this event. Thank you so very much. We'd like to also, of course, thank our guests, Dr. Vandy Gaffney and Mr. Daryl Savs, for making the time to join our conversation and just adding so much, as always, to the conversation. And we certainly want to thank you, the audience, for tuning in this evening and watching. If you're interested in learning more about the vaccine or finding a vaccine site, please visit countmeinga.org. Again, that's countmeinga, all is one word, .org. Count Me In is our Fair Count program to get information and resources to communities being overlooked or underserved by COVID recovery efforts. It's a partnership between Fair Count, which works to ensure everyone counts in every aspect of civic life, and the Southern Economic Advancement Project, which explores policy ideas that address how race, class, and gender, intersect social and economic policy in the South. Again, for more information about the vaccine, about vaccine sites, and just more information overall about COVID-19 recovery efforts, you can begin your search by visiting countmeinga.org. Again, thank you all so very much for joining tonight. Thank you so
Reg,
much.
let me thank you, man. Let me thank you, Reg, and Fair Count, man, for having the wisdom to bring this platform. Everything starts with conversation, brother. And so to allow us to have the conversation is very wise on your part. So thank you.
Yeah, thank you, Reg.
Well, definitely thank you all for attending. And I just thank the entire staff of Fair Count, who some of us may have had the chance to be able to watch, for being able to, for all of us to be able to see the vision and to be able to execute us moving as an organization. And certainly be on the lookout. We'll be having more events similar to this insofar as civic engagement with Black Men Count, and we partnering with more people to make sure that we're getting the information out there to everyone. But again, on behalf of Fair Count, thank you to everyone, and enjoy your evening.
Thanks, Ryan. Thanks, Doc.
Thank you.
I'll see you in a minute, man. I'll see you up there in a minute. Bye-bye.
All right.